Hello, everyone. This is the first episode of our podcast of the year 2013. That's it. We are right
20
here.
what?
13. We
13?
are in a year of big Tumblr. Yes, we are in a year of big Tumblr.
That's 2012, but sure. God, we are still in
Shoot.
dark Tumblr.
So, this is it. This is the new year. So, we are two peeps that we talk a lot about disability in our diversity, usually in a intersectional lens, but mostly in a, personal lens. Anything. Um,
Those are one and
so
the
I
same
think
in
we.
our case.
Hmm? Oh
Think
yeah,
that.
definitely, definitely. Yes, we have our own intersectionalities that uh, we are not just two white, boring cis men that
Well,
neurotypical on
we are
everybody.
white, but.
I'm mentioning the whole thing. Okay, so so for starters, um, so I am Dave. I am a violinist. I'm a music teacher. I'm a Twitch streamer. My pronouns are he, they, and this is Brimby. Is
So we are doing
writer,
this the other way around
shit
today. We are
poster.
being. Okay.
So is the shit poster. The pronouns are they, he, it. We both disabled.
Hit
We are
is
both
my
neuro.
favorite pronoun, not gonna lie. Hit is.
Shut up, Brimby. So, so we are both neurodivergent. We are both disabled. We are both a suspicion of chronic illness.
Not
Mostly me,
illness.
because Rimby is something. So here's the thing: we're going to talk about a lot, and and then we have our socials. That we there's also shenanigans there,
Oh,
and
yes, our
that's it.
socials. Exclamation
Yeah,
mark.
and also yeah,
Socials. That's
yeah,
a thing
and
I
also we
can
have a
do.
YouTube channel that when that where the episodes are archived. When so yeah, here's that. Is the long thing. Yes, I'm clearly Dave. I'm feeling so trans masculine right now.
You're giving yourself dysphoria with that. Are you aware? Spoiler alert, because this was not easy to figure out or anything. I am actually Dave, and the other person there is Rimbi. Um, Today we're gonna talk about. Oh, shut the fuck up. We're gonna talk about disability and privacy. It's a theme that I suggested because I feel like a lot of times the chances that we have to just have, a private life are taken away from us in a lot of aspects. And I also eventually realized that this is still me talking from a pretty privileged position, because the more visibly disabled you are, the most inquisition you're gonna get on it. So
Oh, for sure.
the more you look disabled, the more people will want to know and force you to tell things that otherwise you wouldn't. That is the first layer of it. And the second is that even if you are not physically disabled, in some places, that isn't the case of the country in which we live, but it is the case of a lot of other countries. For simple things like, getting a fucking job so that you don't starve to death, your employers have access to your entire medical record. And I think that for us disabled, this is not hard to understand where this is getting and how problematic this is, because if in your record it says that you are not going to be in the best interest of the company because you're not going to be the most rentable worker because monies and capitalism, then chances you're going to get employed in the first place go down. But that goes for anything if you are just visibly disabled, because if you get to a goddamn job interview and you fucking look disabled, good luck getting the goddamn job. Um, but basically, is to what degree do we have a right to stay private about our conditions, to what degree our autonomy is respected in any sense of the word when it comes to what we want or don't want to share. And the reason why I suggested this theme in the first place was because I had a particularly bad, let's call it episode of fibro before switching medication. And hello, I have no pen. Hello, hello, how are you doing? Um, I had a particularly bad episode of fibro. I was in a lot of pain. I couldn't go up and downstairs without a lot, but I mean a lot of trouble. And I needed to be sitting the whole time. And I can guarantee you that from a group of around, we weren't even 30 people, at least 10 asked me what was wrong and came to me with a lot of fucking intrusive questions like, "Oh, so did you hurt yourself? Do you have a spine problem? Is it chronic?" And I was just there like, dude, I can't even with pain. I just want to be left the fuck alone. I don't want to be asked these kind of questions. This is pretty personal. And how do you even tell people, like, I don't want to answer that without sounding fucking rude because society, you know? So, yeah, that's basically what prompted this whole theme, and I guess I'm already getting into it, and I'm gonna let him be talk because otherwise this is gonna be my podcast and not our podcast.
This is Remy Rumbles. I know he rumbles a lot.
I am
Um,
not Himbi. You are Himbi. Jeez.
it was actually make because I do genuinely rumble a lot. So like I was transposition my identity on you. It's weird. Um, well, like you said, because no, I have to be serious. I think I particularly agree with more disabled, the more obstacles and barriers there are in society. Well, um, actually, I have to formulate this a little better.
Himbi just lost the entirety of their brain in half a second there.
No, because I may because when actually I have to stop, I had to formulate what I'm going to say. Otherwise, I will go into rumble, full rumble. It's going to be extremely incoherent, and I don't want that. I'm trying to avoid doing that.
Mm-hmm.
Um, I guess in my case, I'll not. I don't cannot say that I struggle more with chronic illness as Dave struggles. Because I
I'm
mean,
not
yes,
sure
but
fibro is considered an illness per se. I mean, it's a chronic condition, but I'm not sure you can call it an illness.
it does be called an illness.
It is?
Yes, as
Is
chronic
it?
fatigue, as
It is?
PTO, post so, okay, huh?
I'm a search. I need to search this. You go on your ramble. Go on. Is
Um,
fibro an illness?
I struggle more with the autism and also mental health, um, which they're all interconnected. Like I have autistic, I have a suspicion of OCD, I have ADHD. Um, it's as visible disabilities as they over when they are together, they're kind of difficult to hide it. Um, at least OCD can hide pretty much because it can is mostly confused with autism. So autism is like a disability that I really wanted to hide, but I can't because and this was actually there was like a situation when I was in the I was in the employment center, and they asked what disabilities I had, and I said that I was autistic because of course I said because it was like I was in a position of like if I lie it will become very obvious that I'm disabled, but they don't know what disability it is. But if I don't, there's a chance of me losing autonomy.
I mean, that would
And
happen anyway. Put it this way, if you are visibly disabled, if you don't share what disability you have, when asked in a situation
mm,
like that, it's not a question of you losing your autonomy or not. It's a question of how, by the way, fibro is not an illness, it is a disorder.
Oh, good, good. Okay, stand corrected then. Um, I'm sorry, I lost it. Like, it's not a matter of loss of autonomy. It's a matter of what?
Ah, sorry, I bonked the mic accidentally. I was just covering myself. I'm
What?
so sorry. I went to get water.
Where's the
What you say? I'm
Where's the
sorry.
bunk? No, there's no.
I don't have a bonk command in this channel because I usually don't bonk the mic on the podcast, only on the Pedro channel.
Um, I don't know what you were saying. Actually, I didn't got the last part before you said, "Ah, what if it was a chronic core disorder?"
I
Could
was
you
just
repeat
saying
it?
that you lose your autonomy regardless. It's just a matter on how you
Yeah.
lose your autonomy because if they didn't know you were autistic, but you are still visibly disabled, then they will just assume, and probably they're gonna assume like mental illness or like some cognitive
Oh yeah.
impairment of some sort, which is
Oh
of
yeah,
course
yeah,
gonna be a
yeah,
whole
yeah.
deal because they'll look at you and go like, oh, this person is retarded and they cannot do the job, which is what it is.
Oh yeah. Um. So there's no win-win situation. There's no like. I don't know. I still think that I'm asked decently, and people can only think see me as weird. I don't know. It's because I have a lot of mixed experiences.
Mm-hmm.
Um. I don't know. It's really difficult. Um. I guess because it's a help that I'm not as much self-aware as I wanted to be, for the sake of preserving myself. Uh. But regardless, so basically, they put in a program that I didn't give a consent. I mean, whatever. It's what I do. Like they expect they think that disabled people want to go on that certain program when I didn't want to because I don't think it would fit my goals at the time. Long story.
Mm-hmm.
Um. So like, what you have to focus here is like they didn't give me the opportunity to choose something. They led me to this path, and this was actually very because I deal a lot with loss of autonomy because I was early diagnosed. So I know what it feels like not having any autonomy. And this is about privacy. I'm not I'm going on autonomy. This is related.
I
Uh
mean, I call it disability and privacy because I kind of want to focus on the privacy issue, but it's directly connected to autonomy. So if you go in the path of autonomy, I mean, it's only natural.
yes, because it makes sense for to get to the privacy part. Uh I never had that much privacy. Like people all knew that I was autistic, so I'm like the first person to say that if you cannot, if you can hide your disability in a workplace or school, whatever, and if the cost benefit, um, like it has more benefits than to hide it, I would strongly recommend to do so. Which is, I don't know if it's a controversial position. It's just a
It
self-preservation position.
is a little bit
It
of a
is.
it is a little bit of a controversial position, although I don't understand why because I honestly very much agree with you. But I've seen people arguing both ways. But the way I see it, it's like there is no amount of accommodations usually in a work environment that will be worth you disclosing your medical records, really.
Um, I'm sorry, spaced out a little bit.
It's okay.
Medical.
I'm saying that, yeah, usually it's not worth saying it because there's no amount of accommodations that is going to make up for the ableism you're going to get in return.
Yeah, 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 yeah. Definitely. That's why I say it. Um, I think I can say where is because well, but if you don't disclose it, then there will not be an opening path to get our rights like our accommodations. But like
Oh, we don't have that
it's
anyway.
activism is not individual action. Let's just say it. It's not individual
Mm-hmm.
action. A person has all the right to hide it, to self-preserve themselves.
Mm-hmm.
And for a while, thought a little bit hypocritical because like I was always defending like if you can hide it, please hide it. And I'm the person that used to belong in activism circles, and and I was just not very. They were kind of alienating in some form. Um, but then again, we cannot resolve a systemic issue, which
What
is
is
lack of
alienating? The activism circles, you say? Is that
a
what
little
you...
bit,
Okay.
alienate a little bit.
Hmm.
Um, Especially if you have chronic illness and also kind of a severe mental illness, it can be a little bit alienating.
I mean, any circle can be, to be fair. It's like, apart from some good communities for those specific matters, like for mental health, or for neurodiversity, or like, or for other kinds of disability, unless you are in some of these circles specifically, and people that are actually nice, I do believe that you really don't find communities that, in which it isn't hard to just exist if you are disabled.
Oh yeah, and also because of the political views. Anyway, um, because actually I want to advance a little bit on the topic, which I want to say is one of the points I want to do is if you do if you don't preserve, hide your disabilities, you are less prone to get to be buried and be oh my goodness um facing barriers basically. And and you can just tell you said use the example of workplace, and yes, that's what example that you used. There are the examples
Mhm.
when it is not in your favor to disclose your diagnosis, or at least get even diagnosed, because like if you get the diagnosis, it's in the system, like in the data
Do you
system.
know the irony of that? One of the examples is like in medical stuff. Sometimes it is in your best interest, in medical circumstances, to not tell that you are neurodivergent, for example, which is
Yeah,
ridiculous.
I was going to talk about that.
It's
Yeah.
ridiculous. You are in a medical circle. You are asking for treatment for something that is unrelated to that, and it usually is in your best interest to not tell that you are neurodivergent, because you will not be taken that seriously. Just, you won't just.
Yeah, but it's in the it's in the clinical record.
Yes, yes, but sometimes it is in like parts that are hidden. At least for me, it's very easy, or I've noticed that it's very easy that doctors just don't see it.
Oof, I saw some curious professionals there that would check the clinical record, like
I guess
if they saw.
because I am not, because I don't look disabled, I guess.
No, if they saw a certain specialty, like I don't know, psychiatry, like who tells me that they will not check? Because when you are a healthcare professional, you can actually have almost full clinical record of that patient, at least on that hospital. So,
Mm-hmm.
and there's like in a clinical record, there's one like appears especially like for example neurology, uh, um, whatever, rheumatology, orthopedics, whatever. If these tiers are psychiatry, who tells me that they're not going to check what they have?
Oh yes, they are probably gonna, or in a lot of cases they are gonna. They have the power to do it, at least.
Yeah, and I'm talking not just the physicians, like technicians, nurses. Yeah.
Yeah, but once again, if they don't look at those, it might be in your best interest to, not say anything, for as stupid as it may sound, even though they
Yeah.
technically have access to it.
One example is if you want, if we, I don't know if this is sensitive to you, gender transition. Is this sensitive to you?
No, it is okay.
Okay. So if you want to undergo gender transition, like for example, hormones and such, and surgeries, if you do have a known mental illness diagnosis, who tells me that they will not think, oh, this person has schizophrenia probably their gender dysphoria is related to this to their
I
disorder
mean, put it this
because
way:
the delusional part.
we had J.K. Rowling writing a whole fucking essay in which one of the points, like it's very brief, but it's there, is that trans mask the
Hmm.
in trans mask communities, the number of autistic quote unquote girls was
Yeah,
very
yeah, exactly.
worrying, or I
Hi.
don't remember how she put it. It doesn't really matter. The point is, it is already a thing that people are like, oh, wait, there's a lot of autistic people are trans. Therefore, the problem is that they are autistic clearly, and they don't know better. That is already a thing that people
Yeah, they
believe.
don't have. Yeah, they don't have the agency. Sorry, they don't have the agency to make their own decisions. They are, can be easily influenced. That's I think what's their
Yes,
basically. Yeah.
yeah, that is everyone's headcanon apparently. Which headcanons are fine if they are in fandom, but this is the real life, so please, please don't, please don't headcanon that.
No, that it can as very easily influential people, which usually tends to be neurotypical people actually. But that's
I
not
mean,
the point.
I can be influential. I'm just not easily influenced. I know that's
Influence,
what you.
sorry, no, not
I
not
know,
influential. Influence,
I know
sorry.
that's what you meant. I was just messing around with words, but but yeah,
um,
it is true. Like I, one of the reasons why I am just like, nope, ain't no way I am gonna do this in the public system. Apart from I don't want to get asked questions about how I masturbate for no fucking reason, because that's just fucking rude. Is
uh,
really that
um,
I will be asked, or I will be
why?
probably dismissed on a lot of stuff because I am autistic and I have ADHD. You know, and I don't have the energy to go against that because, a spoiler alert, I also have fibromyalgia and I'm tired all the fucking time. So I just don't feel like going to my family doctor and going like, yo, I'm trans and I might want to do some stuff, to be then sent to another medical professional to evaluate me to get a fucking gender dysphoria diagnosis, to then get asked a bunch of
Oh
fucking
my gosh, yeah.
personal questions that have nothing to do with my gender identity, so that then potentially I can get approved to do testosterone, so that then after like some years of doing that I can finally get fucking top surgery. I'm just not gonna do that.
I am even a worse up case. I am even a worse case because uh, let's just sum up things and say that our system of gender transition is pretty gatekeeping. We had to, at least from what I read, you had to get the medical judgment on. No, 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 sorry. You had to get the diagnosis of gender dysphoria with a special multidisciplinary team.
Mm-hmm.
Uh, there's a bunch of stuff, and also, at least from last year, you had to get approval from the medical college. I don't know if it's the name that you would can translate, but it's like Ordem dos Médicos. Yeah, you had to get
It's
approved.
yeah, it's medical. It's not order
Board,
either.
probably it's board. It's probably board.
It's
Medical
board,
board.
yeah, medical board,
I don't
yeah.
know.
There we go, there we go.
Yeah.
Yeah, yeah, it was something like that.
So yeah, and it lasts a lot of years. Like at least from what I read, it can the minimum amount of years can be 3 years, and at least from personal experiences. Um, actually, I have the articles, but they're in Portuguese.
Mm-hmm. Makes sense.
Um,
It's for our particular
but
context.
I'm
So.
just but I'm just translating how our system is. I
Mm-hmm.
am even a worse case because if that's why I'm also not planning as I previously was planning to get diagnosed with OCD because people can think not just the autism because autism doesn't help in my case, but OCD. Who tells me that I can have intrusive thoughts and or obsession with being, for example, a trans man? Um, they can say that like you're just you probably you have those intrusive thoughts and you believe in them, which not true. Um, but like yeah, there's saneism and ableism when it comes to Like it's always very connected with transphobia. And also, I am in a worse case than Dave because I cannot undergo hormonal treatment because I don't think I just don't want to. I did hormonal treatment years
That's the
before,
funny
and it was
part. I don't, I'm not sure I want
yeah.
to go through T either. I want my boobs removed, but I am not sure I want to go through T, and I
Hmm.
don't think I should have to go through, years of testosterone in order to get top surgery. So
Then yeah, that
I'm kind
exactly.
of in the
Okay,
same
then
I'm
we
kind of in the same position
are the
here.
same kid.
Because like maybe I will want to do
Okay.
T at some point, but I don't know that, and it's like until I get that first thing that is actually causing me like a high dysphoria
Yeah,
gone, until
exactly.
then I cannot even evaluate that. So I would just be going through an entire process that maybe would be necessary, and then I would have to maybe even revert that process just to get to the one thing
Yeah,
that is actually bothering me done. Because, I am a guy, but I'm still a non binary guy.
yeah. Okay, then we can are in the same position. If not the real the same position, what
No,
actually
it's not the
there
same, but it's similar pragmatically on
almost.
that sense.
Okay, okay, sorry, not in terms of identification because I still don't
Yeah, of
cannot put
course, of
myself
course.
in the binaries. I cannot fall in non-binaries. So like, what will require me is like I will have to assume myself as a trans man, which is incredibly despite of that.
Mm-hmm.
Because yeah, so and like no, please, no, I don't want to. Just because this system is fucking gatekeeping and it's gatekeeping from non-binary people.
Yes, but that is even
Uh,
assuming that you can get past the, oh, you're just autistic and you don't know better. Assuming you can even get past that, which is ridiculous.
yeah, and then you cannot, and then but then if you pass that, then we have to do hormonal treatment. But I'm like, no, I don't want to. I don't want to.
Mm-hmm.
Or, um, or if I would want it, I would only do for a certain period of time and then revert again.
Exactly.
Uh, so, but there's no opening to do that because they assume that every trans man is like they want to take they want to be boobs removed, they want to be men so bad like just like cis men, which no.
Mm-hmm. Exactly. That's
And
kind of my
no, I just
situation
want to
here.
which no, I want to gonna just go my top search because like no, I don't listen. This actually, I think that the top search is more for autistic reasons even, which is very ironic. I know.
No, I understand it perfectly. It's sensorily very overwhelming. Please, I don't.
Yeah.
Guys, do you even know how overwhelming it is? The sweat. Like, I swear,
No.
I swear, I didn't want to have this big of tits that I have. Like, I am so sorry, all the girls that would want to have these and don't. But like, honestly, like sometimes just walking and feeling them bouncing, I'm like, no, just please remove these. I am literally a guy. Why do I have these? Oh my god, just let them go away, please, for all that is sacred. And really, the sweat is absolutely maddening. The sensation of it is just like, no, please, I don't want this. It's just
Uh,
sensorily very
for me.
overwhelming. I hate it.
Mm, oh yeah. Like
Also,
since
the
I was
back
very
pain.
young. Oh yeah, for sure. Because what else? Because I remember it's like just being extremely young, like being 12, I think, and like really think to myself, why this thing is growing? I don't need this.
I am so glad that I managed to repress so much stuff until so much later, because my first thought was like, well, now guys will apparently get into me as the gay bastard that I am, you know. So at least that, until I was in, and I coped
Oh
so badly.
no,
I
I
was
was.
that person that was like, boobs are great, everyone loves boobs, aren't they great? Like they're great, everyone loves them. I mean, even gay guys love them, so like they gotta be great, right?
Ah!
Right. This was teenage me trying to cope with it so badly, and I internalized that so much, and now I'm just here kind of like, oh, poor soul, just please someone protect when I
Oh,
will get
poor
past me.
summer child. You innocent summer child.
Absolutely.
No, I was already I was 12 and I was like, and I remember just going under my bed. I'm like, this is so uncomfortable.
Oh yes, I can't lay belly down comfortably. It's so
No, we
bad.
can't. And I could not do this. And running and like,
Oh.
we
Yes.
don't need this. We don't need
No.
this. And
I
I was just,
I wanted
and
to
we are
do
both, we,
sports and I had the bra just being very uncomfortable and I still didn't know how to use one cuz like, everything was very new and I was just there like please just someone take me out of my misery.
yeah, and we were both cross country runners, and I'm like, this is so annoying. I had to dissociate myself. I mean, I don't have this as big, so I could perfectly pretend that they are not there. There's no such thing as a chest. No, there's no such. No, it doesn't exist.
No, I could just not ignore them and guys would make sure that I would not ignore them either. Guys can be so annoying on that. Like God, I
Yeah,
specifically mean the straights because the gays and the bis are usually fine. Mostly the gays are fine, but like the straights though, the cishet guys are so annoying
they're
with
annoying.
that. They're annoying.
Even some lesbians, but that's me
I was
basically.
lucky on that.
Yeah, but I never have someone commenting on them, which, thank God, good choice to not comment on them. Otherwise, I will be just very sad wimpy.
Hmm.
Some is
I'm
terrible
actually
syndrome.
lucky because I kind of do look like a butch, but I never really had lesbians come to me and really showing interest.
Eh, because they kind of like for the lesbians, they're like they seem like a guy.
I I,
Not even
I
not even
think
a very
so.
convincing, not a very convincing butch. Like
Maybe. I guess thanks for the gender euphoria, all the lesbians out there that didn't even talk to me. Thank you very much. Very much appreciated. I guess.
yeah, probably uh yeah, because I can put myself in a lesbian position. I'll be like, no, dude, you look like a dude. Please, no, I don't.
Okay, yeah, but I was presenting very female just like 2 years ago or something. Even a year ago, I was presenting very femme in a way.
Hmm.
At least I had long hair, I guess, and I wasn't binding as often.
But you kind of tied it. So I know it's very interesting that you say that because I mean like because I
I mean,
kind
when
of
you
saw,
met
saw
me,
yourself.
when you met
Mm.
me, I was presenting not as a guy, I guess. Was I?
It's a very interesting thing though. Um,
Oh no, I'm scared. Himbi says it's interesting. I'm scared. How did we end up talking about gender?
we just spent like 5 minutes just talking about this. No, what I mean is it's like when you go like I go with masculine pronouns. I kind of and you also you're not convincing us female presenting though, Dave. Oh, no, you're not convincing. Like, yeah, because that's why probably I barely misgender you because that tends to happen. Because uh,
You know, thank you for the gender euphoria. That's all I was
I
missing.
don't
After
think I
my high
could not.
school friend coming to me and after I come out as trans, going like, okay, that now it makes sense that I had that crush on you even though I was gay back in high school, and I'm like, fuck you. I guess.
No, because now I saw it. Because it makes sense. I could not see you as um.
I'm so not over that. I'm so not over any of
I guess
that.
neutral could also see you, but hmm?
I'm just ranting about how I'm so not over that because, like, recently I had some interesting events like that related to gender in people either assuming my gender incorrectly or just subconsciously assuming it correctly, and like the entire
Yeah,
messes
that's
that
the
come
case.
with it.
I assuming consciously because that's why it never came as a surprise that you were asked because you never said me their dress mess like because I was just it would happen. It would happen eventually. They would come out as friends. It would happen eventually. I was seeing that. I was overseeing that. You know,
I was the most
because
obvious of
you're not
eggs,
very
I
convinced.
guess.
You are. because I was just waiting basically.
Oh,
What? No,
oh.
sorry. I
See,
can't see you
that's
as a boy.
this is the theme of the podcast. It's privacy. I can't have my privacy to just be a guy in secret because apparently everyone knew except me. Wow,
It's possible because I saw you as a boy, but very unconsciously. I cannot say like
that's funny though.
very very unconsciously. Like, but since I have also kind of struggled with knowing gender norms and such, now that I
Mhm,
think retrospectively, like I put myself in Rimby for a few months ago,
mhm,
it made sense why I would think that you were subconsciously a boy.
mhm.
Because I don't know the way that you're talking about certain things, and also your
Oh, apparently I'm a dick about
presentation.
stuff.
Okay, you're a dick. Fair enough. No, no, no.
It
How
just
you
said
would
the
talk
way I
about
talk about
certain.
certain topics. I mean, you're saying that I'm being kind of a guy when I talk about this. And I'm like, okay, I'm a dick. Apparently, I'm sorry.
Interestingly enough, it was about dicks.
Damn it!
Yeah, I don't
The
think I
topic
ever
was
saw
dick.
so. I never saw someone talking so enthusiastically because it's about dicks. Like, uh,
You need to call me out like this, guys. This episode was supposed to be about privacy. I feel my privacy is being absolutely violated. Take me out of this. Oh my god, Rimbi is ableist. You heard it here. Oh my god.
I'm extremely sorry about that. But
It's okay. It's funny, but oh my
but
god.
let me finish, please. Before I actually I leak all your dark secrets. Um,
I mean, I literally have a fucking Tumblr blog with a character of mine for the web story that me and Rimbi are supposedly working on, in which everything that happens there is that I fucking Photoshop ceramic dongs on pictures. So I mean, what secrets at this point?
do you
I
have an healthy obsession with dicks?
I don't have any obsession with dicks. I swear. Oh my god.
Appreciation. Sorry.
I guess.
Okay, appreciation. Sorry, obsession is a kind of a hard stretch.
Jeez, I don't go on Google searching for those, and that would be kind of weird. And I I don't know how to defend myself at this point. I feel like anything that I add will just make it worse. So I just won't. Wow.
I I put Dave in a position that they cannot surrender. I mean, they can surrender. That's the point. They have to. I
Anyway,
put you.
your point was
My point is that I was unconsciously seeing you as a boy by the way that you're talking, presenting, and yeah, that's pretty much it.
okay. See, there is no privacy in this world, and everyone. I I guess I overshared because I am disabled, and now my personal info is everywhere. I don't know. I want you to understand that we lost half of our viewers in the space of 5 minutes because we started talking about dicks. I want you to understand that, Hindi.
We were,
only the strong
weren't they
state.
bots actually?
No, only the strong state. Only the strong are still here.
Like I know. I guess. Um, let's do it. I have no brand. Okay, sorry. Okay. Because I don't remember the topic. It was before this. Yes, transition.
Yes, we were talking about medical stuff. We were talking about how, in certain contexts, like the medical context, it is sometimes wiser to not disclosure stuff about your medical record, for as ironic as that might sound. Um, I guess I would like to now talk more about other kinds of, because I mentioned work at first. We all now mentioned also the medical circles, but I would also like to talk about like more family and friend circles even though these
Uh,
are two very different spheres. But I think in both you have a lot of that because, for example, the first instance I gave of this happening was in a context in which I was semi working, like it was a somewhat professional context, but it was mostly like people that otherwise, they are not really my colleagues per se. Some of those people were actually people that I somewhat consider my friends or somewhat close, um, and they felt entitled to have way more information that I was willing to share. And in those contexts, it gets very, very tricky to say no. Also, we got a new follow, and I didn't see. Bug Boy was a bad boy. Thank you so much for the follow. Sorry, I didn't see it earlier. Um. So yeah. Basically, I feel like there is a lot of society pressure. Even with friends, like with family, it's even way worse. But with friends, to share a bunch of stuff that it doesn't really concern anyone. Because once again, I had more than 1/3 of all the people that were in that event that knew me asking me stuff directly, very intrusively. And sometimes I could just give some vague answers. Like people would ask me, like, "Oh, is it your spine? Oh, not really." Or, "Are you in pain? Oh, yeah, I guess." And go like, "Please fuck off. I don't want to talk to you." But sometimes I had to be a little bit more direct. So, like, for example, when I was asked, "Oh, but that's something temporary, right? It will go away." I just looked at the person and said no. Because I was just so done at that point with all the fucking question. And that's a moment in which a person goes like, "Oh, so it's chronic." And I'm like, "Yes." Without adding anything else, because, well, I don't have to. And at that point, I guess I was being fucking rude. But guess who was rude first? So, yeah.
for me, I got rude questions like, did you got beat up as a child? Which is a very um, interesting question. Um, sorry, are you guys can you hear me? Like,
I
cause
can I can hear you. I just couldn't process what you were saying.
oh, sorry, because I felt a little too silent there. I was like, did I say
No,
all
no,
about
no, no, no.
what the?
I was
Sorry.
multitasking, and also I couldn't hear you well.
Well, when I was saying, I got questions like, did you get beat up as a child, or because probably I was just
Because of
not
your way of
masking.
reacting, like they assumed
It
that
was
it
an
was
air
some trauma.
stylist. It
Also,
was an air stylist.
an hairstylist. Oh, what the
Hmm.
fuck? What the
Yeah.
fuck? Oh, so it's just like a random. It's just like, "Oh, what did you do yesterday? Oh, by the way, did you get beaten as a child? What the actual hell? Do you have trauma?"
No, there.
It's like, what the fuck?
No. They asked that. She asked that because she's just like, I guess people that don't have sensitivity as people that do services. Like they just ask real blunt things. They
Okay,
just
yes.
they're
If there is one place in which I was asked intrusive questions out of no fucking where, was at the hairstylist. Stylist? Jesus. Yes, like for sure. They ask you the most personal stuff, like, "Are you thinking of having kids?" And I'm just like, "I can't, but sure."
oh, they never asked me that. I
they
guess because they thought they wouldn't bother to ask that because no, we don't want this disabled person to have kids.
Okay,
No.
imagine I was getting this haircut that I have right now that is super short. Also, my gay red highlights,
Oh
just
no.
here rocking. And the person asks me if I was thinking of ever being a mom, and I'm like, no. And the person was like, "Oh, but like not ever ever," and I'm like, "No." "Oh, but why?" And I'm like, so many reasons. And I just said, "Well, because I can't." So in
Well,
hope that they would shut the fuck up because, like, oh my god.
incredibly dissonant because like because you are having this haircut because I want to be a queer boy, I want to be a fanboy, a very slight fanboy, and I'm like,
You
but
know.
you're considered having kids.
Yes, I also got asked that same question at the physiotherapy center. Are you thinking of having kids? When are you going to get married?
Why? Why? Man, you
Because
are
I
20.
guess small talk, and I'm just like, the funniest thing is that then when I say that I have a quote unquote boyfriend, which, it's not really the truth in any
That is
sense.
so fake, dude.
It is very fake, but my,
Yeah.
I guess, primary relationship is someone who is male presenting. Um,
Mm.
and it's funny because then people
Eh,
think that we are just a straight
eh,
couple.
eh.
Yeah, male presenting with that hair and those fabulous ways. I know.
Yes.
But like, okay, but put it this way: people still perceive them as a guy for as much as that is awful.
Mm. Mm.
Um, but like, so people look at us and they mostly see, oh, it's a straight couple, and then they keep on asking like, oh,
It
when
is.
are you guys are you guys thinking of getting
Oh
married
my
and
god.
having kids and stuff, like, and when I talk about them, for safety reasons, it's really for safety reasons, I refer to them as my boyfriend, because otherwise I
Yeah,
might
yeah.
get, you know um and and it's always very interesting that people just go like, oh, so not a lesbian, I see, okay. It's like you can see that moment in which they go like, ah, okay, because I'm very masculine presenting, therefore they assume lesbian.
It's kind of weird, you know.
I mean,
This is so weird. I just because for me, Curtis feels incredibly distant, but because I know the full context. So for me, it
mm-hmm.
feels like I'm watching kind of
It's kind of
a
reversed.
movie that just I know what is behind the curtains, and I know the full context. It even feels like irony, ironic. How is it? Dramatic irony. Uh,
Mm-hmm.
and so I'm there just trying to not break down over the fact that this is a facade.
Facade,
You
but
I
yes.
had to facade, sorry. And this is my life actually. I do get in a lot of them because the, the it doesn't make any sense,
I
honestly.
know it doesn't, but then I get extremely intrusive questions, exactly because people know that I
Yeah.
have a quote unquote boyfriend who isn't, but sure, whatever you guys say. And it's like, and here we are not even talking about disability, but um for example, one of the reasons why I don't uh want okay, there are a bunch of reasons why I don't want to and why I can't have kids, and I feel comfortable sharing those because like no one is interrogating me about them, because like it's not like they are incredibly hard to talk about. They are just hard to talk about when I have people judging me, you know. But well, first, I take medication every single day
Mm.
of my life, chronic medication, and I cannot do without my medication, and I don't want to go through a pregnancy without with taking meds that can affect the development of the child. Two, will not stop taking my medication because I'm fucking pregnant. Three, it's probably going to be incredibly dysphoric for me to be pregnant because I am a guy. Uh, Four, if I were to have a child, that child would most definitely be neurodivergent. And for as much as the child would not have, that would not be a problem for me per se, systemically speaking, it is. And I have fibro. I do not have the energy to raise a child against an entire system that will want to, make my life harder. Five, I don't even have the energy to raise a quote unquote normal child because I have a chronic disorder that makes me have pain every single second of my life. So, like, I have a bunch of reasons as to why I can't and don't want to have children, you know. For as much as I love children, I am a teacher. I love kids. I really like kids and I love hanging out with them. They're super fun and they're super chill, and usually they are very understanding when they are not being, pieces of
Dicks.
crap because they don't know what empathy is. But when they have 2 seconds to spare to try to have some empathy, they're great. I love them. Um, but like then I get questions like, "Oh, why don't you want to have kids?" And like, am I supposed to go through an entire fake answer to this? Can I just tell you that I'm disabled and like that
And
I
play
don't
your
want
genetic
to?
card.
And yeah, exactly. But even then, even if I play my genetic card, it's like I don't look autistic. Then therefore, if the person doesn't know that I am, they will have to.
I can play your generic card, and also me, because people generally think that I probably will not be able to raise kids because
Yep.
of ADHD.
Just because you look autistic, yes, autistic, disabled overall.
Yeah,
So I guess
I
people
mean,
don't
I'm
even
not
ask you
mad.
that.
No, they don't. I mean, I'm not mad because, well, one less boring, annoying question. But at the same time, it gives the perception. But it
Yeah,
gives me
like
the
what it
perception
means to
that
not
people
be
will
asked
prefer.
that.
Hmm?
It's like it's good that you don't ask that, you don't get asked that, but the implications on to why you don't get asked that though are pretty messed up.
Is I agree because it's. I mean, it's preferred that I will not have kids because I will not be able to raise them, and two, they would be disabled as well. So yeah, mostly genetics reasons. I'm not mad. It's just I don't mind not having kids. Uh,
Hmm. Listen, I am actually not sure if I don't think I would want to have my own, but I would probably like to adopt, which then will be a fucking problem because I am assuming that for that people will indeed have
need
access
to.
to my fucking medical records.
Yeah, yeah.
If I
It's another
ever
thing. Like,
think about that,
yeah, if you
which
want to
I'm not
adopt, it's
sure.
difficult as well.
Yeah, yeah, it's like I'm not even sure I will ever have the, because it's not just a question of energy per se. Because put it this way, if I lived home without having to be concerned about, bringing money home and a bunch of other stuff, if I just have time to spare, you know, I probably have the energy to take care of a child. And maybe that would be something that I would like to do at some point. But if those are not my life circumstances, then no. But then it will be a question of like, where will I be in life? Will I be a rich ass motherfucker or not? Which I probably won't. Um, because guess what? Being disabled and being rich are usually not a thing that happens. So, it's really that. But even to go through the process of that, what can I even hide or not? Because if I get there like, oh, I am autistic and I have fibromyalgia, can I please have a kid? Hmm. Hmm. Also, by the way, I'm trans. And I am a guy and I'm dating a person that presents male. Um, yes. Great idea.
It's feasible. It's feasible, mate. Um, I don't know. I'm actually. I don't know. I don't know if it is a spiral, but sorry. I think I'm trying to. Uh, because I'm thinking of mental illness right now. Because the thing, I
Mm-hmm.
want to be diagnosed with OCD, right? But I don't know in which ways it could limit in the future if I did get.
Mm-hmm.
That's what I'm
I
thinking.
mean, why do you want to diagnose this in this case?
Validation?
Okay. No, yeah, because I was asking if it was a question of like getting assistance, getting
I don't know. It's I would less likely. I would really want therapy. That's mostly what I want to. At least therapy. but that's just a little bit impossible in the public system. Um,
Yeah. I mean,
so not even medication.
I know of people that did get an OCD diagnosis through the national health care
Yeah, yeah, it's kind of
through a
it's not that complicated.
it's
Yeah,
a neurologist. I think so. I think it was a
neurologist.
yes, a neurologist. Yes.
That's not a neurological disorder. Why they went there?
In that case was because they were having some problems that were affecting like the entire body, and they thought it could be some neurological
Uh,
problem,
uh,
and that's
oh
through the way they got the diagnosis. It was actually the neurologist taking care of it somehow, but that's how it worked in that particular case because it was like a very advanced case of OCD. By advanced, I mean like with hardcore compulsions and stuff going on.
compulsions. Um,
Yeah,
mm-hmm.
yeah, it got to a pretty dangerous point for the person,
I
not
see.
for others.
I
But
see. Oh yeah, because people get confused because they think that we are mothers because of the intrusive thoughts and such. No, usually we do harm ourselves. Um,
I didn't know that was the perception people had because, like, I actually had not
yes, we can. They can have because
the
um,
first time I even heard of OCD. God, the shit I say on Twitch.tv, I swear, was a yaoi manga. And like the way it was portrayed, the way it was portrayed was actually pretty humane. And it was always like all the things that were happening were always bad to the individual that had OCD and not anyone really around. Like it was hard for people around to sometimes cope because they didn't know how to help or what to do really. But for the person was always worse. So like I felt like that gave me at least a, even if not accurate at all, at least a more understanding positioning towards it. And that was really truly the first representation I've ever saw of it. So
no, I saw in Criminal Minds it was damaging. Um,
oh yeah, Criminal. I watched Criminal Minds. Who had OCD? Was it anyone of the main cast?
no, no, criminals.
It was just a random criminal. Okay, and in some episodes, gotcha. Because I used
Yeah,
to watch Criminal Minds. Don't remember. If I don't know if I saw that
yes.
episode.
Oh yeah, I used to watch all the time as well.
Mhm.
Um, and well, what tends to happen is like I guess I have the experience of having episode people, and at least one person would think that was going to hurt her several times. She made that explicit. Sorry. But usually it's but I don't know if it's really a seal or not a thing. Sometimes I don't know the difference. But usually fetal is pretty much self harmless if it gets that bad.
Mhm. Mhm.
If it
Mhm.
gets that bad, really.
Yeah. It's in this case I wasn't even particularly talking about self harm as much as I was talking about behaviors that
Mm-hmm.
will end up causing harm to the person, even though their purpose is not self harm per se. If that makes sense.
Oh, I see. I see.
That's mostly what I was talking about. It's like behaviors that will cause
Getting
harm to
stuck
an
in the position.
individual. Exactly, getting stuck in positions that are going to be harmful physically or otherwise.
Like, yeah, yeah. I feel. I know the feeling of
Yeah.
getting stuck. Probably they're ritualizing. They have to
Mm-hmm.
do that several times until
Exactly,
it goes over.
exactly, exactly. And
Okay.
it was starting to go into how you call it, eating procedures and stuff like that, and that's when it started being pretty messed up.
Indian disorder.
Yeah, it developed into eating disorders
Mm-hmm.
and stuff. So that's why they were sent to a neurologist, and from there they got the OCD diagnosis.
That's weird because it's not even the disorders are not neurologist stuff anyway. But I don't want to get into
I
this.
I don't know how it happened through that course of action. I guess I don't know exactly because I mean I also learned about this in like 1.5 hour conversation after I didn't see that person for like 5 years. So there's my knowledge on the subject is limited, and of course I also am trying to not disclosure anything that is personal in the sense
Yes,
of like
understand.
identifying or anything of the sort.
Yeah, I do understand. No, I was just finding out that they even when they didn't start, they were sent to the neurology.
Don't ask me, I
That's
just
what I
don't know.
was. I'm being picky right now. Sorry.
Listen,
Um.
but put it this way, I got to my family doctor saying I have pain all the time and I was sent to a neurosurgeon. And the neurosurgeon was the person telling me you have fibro, have medication that will help you. So, I mean, are you really going to question that?
No. I was being pedantic because it's about preference.
I mean, yes, especially when the healthcare system is stupid and sends you to the wrong
Yeah. No, it's probably yeah,
specialty.
exactly. Yeah, exactly. I was probably concerned with like, do people actually consider this as a neurological issue? Which, like I said, it was with me being a little bit pedantic.
Gotcha, gotcha. No. It's a valid concern. It's a valid
Okay.
concern.
Um. Uh. Yes, it can develop into a disorder if because they just feel if something goes will happen bad, something bad will happen if you eat that shit.
Mm-hmm.
Yeah. Uh. I don't have as much rituals though. It's amazing how I don't have them. I guess because it doesn't reach that point that often.
Yeah.
I'm speaking now about me. I'm making this about myself
That is, I
anyway.
mean, this podcast is about ourselves anyway. Like, of course, then our individual experiences get um, allow us to talk about more generalized subjects and to take conclusions on stuff. But we are still two people talking about our experiences as disabled people, so I guess that makes sense. But
Mm,
yeah. But
for
yeah,
sure.
the only people that I've heard about with OCD, apart from not a person, a character. The first representation I saw of OCD were just straight up real people that I knew. A friend of mine that I met before you, then you, Rimbi, and now this person that I just learned very recently that also has OCD. So I guess I am not in a position in which I can tell what the generalized opinion on OCD is, because I guess I just don't know.
Me neither. I'm recently. I
Like,
mean,
what is the
just kind of an old
stereotype?
suspicion. Huh?
What is the stereotype of the person with OCD? I have no idea.
Cleaning. Oh, they clean too much. No, actually, I know because people are like, oh, this is so OCD. Because I do remember before. I was unconsciously thinking that I would have OCD, but very
Mm,
unconscious. I was repressing all the time because I even have an old suspicion when I was 12. Um,
damn.
but basically, I could observe the stereotypes, which is, oh, this is, I have to put this in order. Like I put the pens in order. I have OCD. Like, or I clean. Like I know my mom that cleans a lot. She seems like she has OCD. Like she cleans the room a lot and like such. It's those are the stereotypes. The cleaning and the order quirks.
Okay, I did have the cleaning one as a mental thing for a while.
Hmm?
Yes. I did have the idea of the cleaning in my repertoire of what OCD could be like for a while, yes. So,
In,
yes, I guess.
interestingly enough, no, I know actually I don't have that. I would say like
No,
not even the opposite. No, um,
I don't know anyone who does.
honestly, me neither. My mom, she also has a suspicion that she has. I don't think she has something with symmetry, but or other or something. Because
It's symmetry. Okay.
not
No,
not symmetry. Sorry, and symmetry is another thing that OCD people can have. Like they have this obsession with those symmetry. That's I'm referring to the common ones. Like oh yes, but no, they're the stereotypes. But like at the same time, they are things
okay,
that
my
are
mom
kind of
does have a
common with.
thing with cleaning, but I don't think she's OCD in any way.
No, my mom kind is. My mom is. I don't think she was the issues with cleaning. She kind of is like in a case that it seems some clinical trait. Like she can have, but also doesn't have at the same time. She feels a little bit obsessive, but I don't think it's obsessive. It's weird.
Mhm. Mhm.
But I did notice because we basically have the same primitive thought pattern. So,
Mhm.
and she kind of also has this thing when she scratches the skin. She's even more extreme than me, uh,
Uh,
and
yeah. I also have that.
she rubs the skin, and and she thinks like this is normal, isn't it? Like I'm scratching my hands, and when I'm nervous, this is clearly something that ridiculous people do, right?
I do that with
No,
my face all the fucking time.
it can be steaming or it can be compulsion. Tell apart, please.
I don't know how to tell them apart.
It's difficult, really. Uh, I had to,
Sorry, because it's like
actually.
me. Tell me, because you have both, so maybe you can distinguish them. You it's hard. It
No, no,
sucks
no.
to be
Let me.
me.
Okay, okay. I will help you. Did it reach to the point that it would become painful? Like you're doing too much that becomes painful.
Yes, sometimes it does happen.
What do you mean? Sometimes it does happen.
Sometimes I am indeed scratching my face, and indeed I go too far, and indeed it hurts, and sometimes I don't stop regardless because I don't know why. I genuinely don't know why.
Could you tell the emotional state where that you feel like it when you do that?
Dude, I have alexithymia. I I I don't know, man. It's just I guess I'm anxious? Question mark. I don't know why. It just I guess
With
I'm
you,
just
it's diff.
annoyed. I'm annoyed. It's not anxious. It's
That also.
annoyance. It's something is not like I
Mm,
want it to be.
mm.
I guess it's the best way I can put it. It's very specific, but at the same time, I don't have like any emotional marker for me to pinpoint it.
Distressed.
Yeah, I guess.
Mm, okay. Um. Do you do other things when you're distressed? Like things that are done repeatedly?
Apart from regular stims, no, because like I do the rocking thing, but that's just a stim of mine. I do scratch my head a lot, which, but I mean that still falls into the scratching stuff. I used to pull my hair, but I don't anymore.
Huh. Interesting.
I didn't pull it to the point that it would actually, like that I would remove it or something. But I would like grab big parts of my hair because it like the sensation that it gave on my head was like pain, but it was a kind of pain that was distributed and that felt grounding in a very messed up way. I guess it was a form of self harm without actually, being too harmful. Not so sure.
Yeah, because it feels good because your body is releasing a form of opioids because we do produce opioids
Gotcha.
that inform hormones that when it happens when you do self harm.
I
That's why it
guess
feels
it
good.
doesn't happen anymore because since I'm in pain all the time, everything that is extra pain actually feels terrible. It's very rare that I feel pain now that actually feels nice. Because, like, I would sometimes before feel pain or even cause myself some controlled pain that felt nice. Like, for example, for the people that are like, oh no, this is some form of self harm. No, doing exercise, it hurts. Like, if you go too far a little bit, it hurts, and in the next day, it hurts, but it used to feel nice because it was just like, oh man, I worked so fucking hard, I guess. Like, and you
Yeah,
get
yeah,
that,
same.
like, it feels physically good. Those kinds of pain used to feel good. Um, and some other forms of, like, I would, like, slightly scratch my arm, but, like, without actually leaving any marks or anything of the sort, just because the scratching sensation would feel nice. and of course I would stop before it actually started hurting me or something like that, and those would feel nice. Or like when you stretch and you stretch just a little bit too much and you get that pain of like then releasing it, like those used to feel very nice. Those don't really feel nice to me anymore. The stretching one sometimes does, but it's always a very thin line between this feels good and oh my god, this was a terrible idea, why did I even? It's very thin. I never know where the line is, and yeah, it's always a risk on that one. Um,
Did you feel feel the impulse to do it, like? But then you realize that I'm overdoing it at the same time.
yeah,
Interesting. Because it's the thing, you are a tricky case because you did a lot of what's the name? Cognitive reconstruction. Evaluation. Sorry, they have
yes,
both names
cognitive
for some
revaluation,
reason. It was
yes.
true. So the thought patterns are,
I guess I don't get stuck all that often, therefore,
yeah. It seems like you resolved.
yeah, that because listen, that's even how my ruminative thoughts tend to work. Like I tend to get stuck on something for a while, but then I actually am able to break out the loop and solve it. So, like, my ruminative thoughts don't tend to be very intrusive, or when they are, I can most of the times have some control over them and resolve the situation and move on. So they aren't ruminative for very long, exactly because I am thankfully extremely good at just looking at things from other angles and solving whatever the loop I was stuck at was. I'm very good at that. So I guess
It it will not be far fetched to consider you an unresolved OCD case.
I don't think I ever had OCD though. At any point. I might have had like tendencies towards it and like compulsions of
Mm.
some sort, but never to a point in which it was OCD or anything
I
like
said
that.
far fetched, not that far fetched, but it cannot might be
Okay.
the case. Sorry, there's some signs, but
Hmm.
it also kind of overlaps with BD a bit with the self harm thing.
True,
So
which I
it's getting a
also
little bit
don't
difficult to tell
have,
apart.
but I'm close. I am
Yeah, I
a
have some traits.
case of like being close to have diagnosis on things, but it's like, ah, you're missing one or two criteria here because you actually did some quote unquote self therapy and solved it before it became problematic. And I'm like, I guess that's good.
Yeah, I think yeah. So I think I think
No,
so.
it is good. It is good, and I'm not complaining. It's just funny that it keeps happening.
Mm. Mm. No, at least I have the traits of OCD. The all the traits. I think that's just too
You
rough.
do seem to me like a clear cut case of OCD from what I've seen and heard from other people with OCD, which is not a very big sample, fair enough. But I do see common traits between the three of you.
Oh yeah, probably like you get stuck in the place. You're always doing the thing. No, no, no. Probably.
It's not
Um.
even about how you even start talking about things. It's actually the thing that I feel like the three of you even have more in common is that just how much you all get worked up to even touch specific subjects and just go on and on until you actually get to the actual point because you are so worried that something in that conversation is going to get messed up and you're going to be misinterpreted about it. And I'm just like, okay, here we go again. Let's just a person have their moment.
Okay. I actually I give a lot of not context, like just to over explaining everything.
Yeah, it's like sometimes I want you to actually explain stuff and you won't. Like that is a thing that happens, but most of the time, but before you actually start talking about something, you just start saying so much info that I don't even see how it's related to the actual thing, but apparently it is. and you just go on, and then you actually get to the thing, and I'm like, okay, why were you making such a big deal about this? Okay, gotcha.
Mm. If I'm were to guess, I think it's because you need to get a precise image of what I'm talking about. If I'm were to guess.
Yes, but see, if I point out these to any of you three, that's exactly the answer that I'm gonna get. So I find it funny that the thing that I find like the three of you have most in common is just this anxiety about getting things through and making sure that the conversation is in the place where you think you are. And I'm just like, chillax.
The neurotypical, no, this is the neurotypical. Just calm down. Don't be anxious. Just calm down. Do mindfulness. Do yoga. Oh my goodness, Dave. Oh God.
Well, that's not what I mean, and that's exactly why I
And
don't call
just I
you
know.
out usually, because otherwise I would be, a dick.
No, no, no. I see. I see. I see. No, another thing that also I noticed that I have is like I keep reassuring, like always reassuring, like no, this is not what I meant. I meant this. No, no, no. Please don't interpret this way. Interpret this way. Which also kind of stems also from my conversation with my mom, because like she would interpret in the very wrong way, and I'll be like, no, 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 please, no, this is the thing, this is the thing, not the other thing. This I meant this thing, not the other thing. Like, this is actually a bad habit, actually.
Sorry, I was
Because
reading
no, 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 no,
chat,
no.
and I have no pen said, there's a French meme that goes, you're sad, stop, and that's the same energy. Honestly, yes. You're sad, stop.
You're anxious. Just calm down.
Oh, the
Oh,
amount
you
of
have
times
an
I heard
eating
stuff like
disorder. Just eat more.
I've heard that one way too many times because, as you know, I had an eating disorder when I was 16, up
Hmm,
until I was like 18, 19. Um,
that's
like
a while.
it started getting better as I went, but the last time I had an episode of it, I was like 19, 20. Um, and basically the way it would work is that if I had some extreme anxiety episode, it would trigger my liver to release some things into my stomach, some liquid, that
Hmm.
would stop me from being able to eat and digest food. I would just get extremely sick. And there was nothing that I could do about it because it was straight up a physical reaction to my anxiety. And well, right now it's very easy for me to say this, but at the time I had no fucking idea about what was going on. Um, and I was just desperately trying very hard to eat, and everyone around me was getting extremely angry at me because I just wasn't eating, which of course would raise my levels of anxiety and just create the fucking cycle that I couldn't break. But yeah, the amount of times that I heard "eat the goddamn food" is insane.
Yeah,
while
this
while I was
not.
looking at the
Yeah,
food
sorry.
and just like I want to,
No.
I can't.
I was also talking about me, not just me. Also referred to both of us that we
Mm-hmm.
also got told that. I also, yes, you can consider this an eating disorder. Yes, you can. Which basically, um, I just look at the food I don't and I cannot eat. Um, sometimes I am angry. Sometimes I want to eat something, but I cannot. So I'm stuck in this. My goodness! But visually, and textually, and even the smell, everything is. I
Mm-hmm.
cannot eat it. I mean, just says no all the time. So I had to trick myself to eat, and like, so I'm in this limbo that if I do the shenanigans that I need to do to eat, I feel like this is not compulsion. It is, I really have to close my eyes and actually sometimes even pinch my nose to not feel the thing so I can eat it. And people will
Mm-hmm.
find this extremely odd, but that's, but
No, no,
this,
no. I would do that
but I,
the exact thing because if I didn't smell the food, it would be easier for me to eat. So because I couldn't straight up do that to my nose because then people would start complaining around me and it would just trigger my anxiety even more. I learned to stop the air flux without pinching my nose. so that I could eat without smelling. I learned to do that without just doing it with my hand. So I know exactly what you mean.
Uh, mm, yeah. I also kind of learn how to dissociate myself from the food. So like I'm not. So what happened is like I associate a lot, and then I realized that at least one after like I'm still angry, and I didn't feel that like I ate, but that's because I dissociate myself from the food,
Hmm.
which is not nice, because it makes me eat more. Um,
I mean, but
and
when your problem is not eating enough, eating more is a good thing.
but I have body issues. I think I have, or at least some level of it,
You do?
kind of.
Okay.
It's more well, like there's some what I mean like is that there's some fear, not very severe, or just a slight fear of me becoming of having more weight, so to speak.
That is so weird because you are very skinny. How are you afraid of being fat? Sorry.
Because that's what happened when you're born. Because that's what happens when you're born in a family that
Is fat phobic?
um mm, extremely. It my
Ugh.
parents were fitness trainers, so
Oh,
at least when they met each other, they were fitness trainers, so they have certain phorophobic ideas, and they still
oh
perpetuate to this
no.
day, even though my mom had an eating disorder, but that's besides the point, because whatever.
That is so messed up.
So, it's my sister also has body issues because let's just say one of them decided to touch her belly and actually point out that she has fatness on her belly, which, spoiler, it's actually normal fat from actually the uterus. It's like I think it's a water
Oh my
deposit, I
goodness.
think.
Yeah, and sometimes it's just your body shape. Because, for example, I was extremely skinny during my eating disorder phase, and like I was aware of it. Like I knew that I was getting pretty skinny. I was dressing the same clothing that my mom was wearing when she was a teen, and she was underweight. So like I, at least for the clothing that I was wearing, I was aware that I was starting to get underweight, really. And I was getting too skinny, and that if I kept on going at that rate, it would start getting extremely unhealthy. I was aware of that. Um, but even then, like the shape of my body, I have a very round belly. It's just the way the shape of my body, and it's not that I don't have like enough muscle in that area or anything. No, like my abdomen is actually one of the strongest parts of my body, but it just so happens that my body shape makes it so that I have a pretty round belly. Even if I'm extremely skinny, even if like my legs and arms are pretty much bone and skin, my belly is still fucking round, and that's just the way it is. It's really not. I mean, I guess it's fat, but it's just where it gets accumulated. I suppose it's just the body shape.
Yeah. Uh, oh yeah, like my friends will be obsessed, like, you know, if you're that concentrating on of them, you can have heart issues, and I'm like, fuck you. You can
Oh,
have heart issues in many different ways, mate. You can have heart issues in many different ways.
even from being too skinny.
Yes, you can. You're actually it's more dangerous to be skinny. Actually, be extremely
Yep,
skinny.
yep, yep,
It's
yep,
very dangerous.
yep. It's just so stupid overall, that whole deal with it.
Yeah, but my sister also has body issues because of that. She told me a few days ago.
Damn it.
Yeah.
Oh, that sucks. But yeah, about that, like, so like I was having these issues during high school, and like there was a lot going on with my life. But the one thing that was like the trigger, the little drop, the straw that broke the camel's back, was me having a cyst on my breast that the doctors didn't know at the time if it was cancerous or not, because the results came in inconclusive. Like one said it was cancerous, and the other one said it wasn't. I had an emergency surgery because of that, and that's what triggered it. Because I was fucking scared I was gonna die. Um, and I think reasonably so. And I was very scared that I was going to die before I got to do anything that I wanted to do with my life, because I was raised as, a trophy in a sense, to always have the best results that one can have, and I was always uh, doing things for others, and I never got a chance to live the life that I wanted to live. And that messed with me. That messed really hard with me. Um, but I was a very strong person, and in a way, I had a lot of toxic masculinity internalized, in the sense of like, I didn't want to depend on anyone. I didn't want to show weakness. I was still going to physical education classes and running as even though I didn't have anything on my stomach the entire day, and not flinching and stuff like that. So eventually, when I had the surgery, because like it still took a couple months for, because I say emergency, but it was like I was in priority to have the surgery. I wasn't like on the hospital to then have it immediately. Um, but yeah, basically, then I had a period in which I couldn't go to classes because I was still recovering from surgery. While not eating enough. And like when the teacher responsible for my class learned about this, apparently she went to talk to my parents because I didn't say anything to her. And she was like, "Oh, but uh the student is always so up high and just so cheerful during classes. I could have never guessed." And to me, there are two things here that really pop out. One is, of course, if everything looks fine, then kids don't have problems, right? Right. And the second thing is the idea that you have to disclosure everything that is going on with your life, with your medical records, with your mental health, in order to get the necessary attention. During high school, we are minors. We
Oh
are
yeah.
talking about people that, they are still learning how to be. I guess I'm still learning how to be, and I'm fucking 26. So I guess my point here is that 10 years ago, I had a teacher going like super surprised that, because then my mom shared with her that I was having also problems eating and all of that. Because my mom thought it was getting a little bit problematic, I guess, and well, it was. And the teacher was just like, she believed it, but she was not really being able to believe it, because
You just pretend very fine.
I pretended very fine, but that's the thing. I don't think that anyone had anything to do with it. I didn't feel like anyone had to know
Oh yeah.
what I was going on with me, because it was very private. I'm sorry, but no one needs to know that I feel like I'm struggling for my fucking life. I think that's
Because
pretty
then,
personal.
yeah, and also because you probably would have a lot of false sympathy.
Exactly, like I don't want to go to my teachers and go like, "Yo, so I'm not sure if I have cancer or not." Like, sorry, that's not a thing that I want to do, and I don't want to have to
Oh yeah,
deal
same.
with people dealing with that. I'm sorry, it's awful. It sucks ass.
I
It's
feel you there.
it's very personal, and the fact that I would have to say something like this in order to just have people checking on me when I'm just a fucking teenager just trying to fucking exist, it's pretty messed up. I shouldn't have to disclose personal information like this to just, get treated like a fucking human being. Because, like, from that moment on, then teachers started being so fucking careful with me, which I absolutely hated, by the way. Because it was that fucking care of, like, oh, shit, something is going on, instead of, being care of, as in, we care for you, and if anything happens, you can count on us, which is a thing that teenagers don't really get all that often, or anyone else for that matter.
I guess since you're talking about that, um,
Yes, I'm
um,
following the theme of the podcast, which is privacy and disability. I know it's surprising that we are actually staying in theme for a while.
thank you for coming back to the theme. Because I was being an OCD mess. Okay. Um,
And that is okay. We love your OCD mess.
Oh, thank you. I guess there was actually a dilemma with me and my mom when if we should disclose our autism diagnosis in school. We personally didn't because I guess I was kind of lucky that my mom was actually more careful with me and was also holding the opinion that I didn't have to disclose anything
Mm-hmm.
if it was. Yeah, there was some loss of autonomy by her, but like not given how I see all the autism moms, it wasn't that much extreme. She was even kind of progressive even at the time. I'm talking about 2005, 2006. Um, and and so we didn't disclose it, even though well, it's obvious that I'm disabled. But I thought at the time that I was not as disabled as I thought I was. Like I thought I was just probably would perceive as just a shy person, just as someone that just doesn't talk that much, but smart and could get good grades and actually kind of interesting person to talk to. But no. But why? Because we both were aware very unconsciously at the time of the stigma. And don't get me wrong, I was openly autistic in my primary school. Then on middle school, I saw a chance that we chose a chance that we didn't we because since it was a new school, we didn't have to disclose it. So like, because I genuinely didn't see any need to disclose it at the time, and I still do believe that because I don't think I would benefit from any accommodations that the school provide. Um, I mean, okay, probably more time to do the exams, but that's literally because of the other disability I have, which is dysgraphia, because it makes me hard to write the exams. But that's pretty much it, you know. And and because I even didn't know at the time that I had ADHD, so I had to think of what kind of they could provide me at the time. And honestly, it's scary. You know, it's because I don't know because when I think of disclosing autism diagnosis, which is mostly never, um, there's a question that comes to my mind is like what is the perception of this of the what is this person perception of autism. it's never a
Exactly.
it's never a certain answer because it's very it's such a blob condition that people all have all sorts of misconceptions.
Oh yeah,
And
it's like I know that you are a nice person, and if in under normal circumstances you would be very fine about this. But what is your opinion on autism? Like, if I tell you this, will you get what I'm saying, or will you just take the
or will it
most
change your
wrong?
perception of my of
Yeah, because you have the most wrong conclusions out of that. Like, how wrong is your conclusions gonna be, and is it okay? And do I have the energy to deconstruct that or not for you?
most of the times I don't have um
Fair.
and because I'm not in position given my mm, the a lot of labels trauma that I've endured. I'm not in a position to deconstruct because it has been proven futile. Um, it's just uh, okay. I lost it. Let me.
Mood. You can do it. I believe
Thank you. It's also because I also come from an ancient time, which I do remember vividly how autism was perceived. We were talking about 2010
you.
or 2009, which is something that you probably didn't heard at the time, or at least you didn't have the full perception of it. But I did remember how we were perceived, and not a great time to be autistic. Um, because I guess there were starting to be talks about ABA, like the behavior therapy.
Oh.
It was not a thing in 2005 in here in Portugal, but I think it was start to be a thing back then.
Mm.
And there was the Asperger syndrome talk. There was a lot of Aspen supremacy at the time. God damn it! How did I survive that terrible time? Um, uh, and it made me reconsider because I was kind of a proud because I did remember writing a poem, which probably was the first poem that I wrote about how proud I was for being autistic. This is really weird to say, but when I
It
wrote
isn't.
that shit,
I mean, I'm pretty proud of being autistic. I know that's not everyone's experience, but I personally am.
but yeah, but given how much I was the trauma that I went, being proud of being autistic, like I guess at the time was kind of like, God, that's even progressive. Even that changed, of course, but it was kind of progressive because like most autistics that I know that were also already diagnosed that I met is like I was not proud. I was basically ashamed. And I'm like, I was not ashamed. I would become ashamed later, but I was not ashamed at the time.
Mhm.
Um, it's just, but that is, and because probably I would sometimes tell to other people that I was. That happened to some mates. I remember just telling to, at least to some peeps that actually I was, and I mean they didn't treat me very nice after. I mean, but it's probably because they were not treating me well nice before because I was just kind of naive, I guess. I was just. I remember the time that I was just being very proud and like just enjoy like oh my goodness I am autistic. I have autism. Probably that would say probably I would say that I have autism. This 2010. Um, and I guess I kind of regret doing that after I got back into the place of shame. Uh, and now it's very interesting that now I'm proud of being autistic, but now I'm more careful with how I disclose my autism diagnosis.
Same.
Uh,
And for me, it was a thing of hyper focus because, like, a lot of times I was way too self conscious about my autism, especially after my diagnosis. So, like, in a lot of circumstances, I would feel pressured by myself to say it because I always felt like it was being relevant to the way I was acting, which fair enough it was. Like, but on the other hand, it was putting too much effort, too much focus, sorry, on it, if that makes sense. So I would get a lot more of the thing of like, should I say it? Should I not? Fuck, kind of deal. And I guess now unless it's like blatantly obvious that it's a kind of situation in which I will have to either say it or hide it,
hmm.
I kind of just don't say anything.
Me neither. Unless you ask me directly if I have a disability or not, and if it's
Exactly.
a specific context that I see some benefit in saying it, I can say it.
I mean,
But if
a lot of
it's not,
times if I get asked, if I don't see any benefit in it, I just can't lie. If I'm not ready to have to lie about something, I usually just can't because I don't see the point. And even if I do, it feels wrong, and I just get the worst possible reactions out of it. But that's really personal. It's just a me problem.
mm, I'm sorry, I got really lost.
Oh, just saying that it's a me problem that I feel like I can't lie in these kinds of circumstances. If I get asked directly, I just
mm,
kind of can't go like, oh no,
it's difficult to put me in that position because I don't have people that uh
go to you and ask you, oh, are you disabled?
no.
Oh, that's good. At least that.
I was not convincing. Not convincing.
Not convincing. I do have a lot of people that come to me and ask me if I have a problem.
Well, um
I have so many problems, like my finances. Please put $1 million in my bank account. That's
I
the
have
kind of
one
answer that
problem.
people should.
Yeah, yes, I have.
Capitalism.
Yes, I have a problem. It's you.
You talking to me is my problem right now.
Yes, exactly.
God, I sounded so robotic. I was literally falling into the robot with no feelings that is kind of autistic stereotype right fucking there. Oh, that was so silly.
It's just falling to the customer mode type of deal. Like, for instance,
Oh, it wasn't even on purpose. I wasn't trying. I wasn't even trying to be Mimi.
you know, you're
I was just
ableist.
existing. Oh, my existence is ableist.
Yes,
Beautiful.
your disabled exists to disablest.
Okay.
Goddamn, now you're being ableist, really.
No, I wasn't making fun of you saying it. I was making fun of how my brain interpreted it. It was my audio processing being stupid.
Okay, I'm sorry then. Okay, we had to disclose something here. Like, I do have problems with speech, and he has problems with audio processing. So it's also so our conversations are very interesting.
Especially in person, because like when we have like when it's in on Discord and we have calls and like there's good mic quality, I can understand him just fine. But if we are in person sometimes though, I'm just still like, okay, I will understand this. I swear. I am strong. I am a strong, independent man. I don't need to ask again what they said. I can understand this. I swear. Spoiler alert, I
Remy, what the
didn't.
fuck did you just say? And I'm like, oh, listen, I will maintain what I said on that day. Like, you can ask as many times
Oh,
as
I
you want.
know, but do you think my uh, proud ass can get around that? Wow.
Oh yeah, because now I will understand just fine, and then you don't.
I am a strong boy. I don't need no one to just fucking repeat what they said. I can do this. Look at me, so strong. Uh,
Look at you, so strong boy, my strong boy.
uh Spoiler alert, I wasn't
No.
strong. I didn't get a single thing. Uh, I tried so hard and got so far.
Okay, I have my small mental breakdown right now.
Yes. Maybe by the way, I should probably log off in like 10 minutes or something. Just to let you know. Because I slept 12 hours today because I'm fucking disabled. Billiam! Hello!
Yay! Hello,
It
Billion.
it's just the Discord for the podcast is just my own server because that's where I usually say when I'm gonna stream anyway, here or otherwise. So, and we have a channel there for the podcast in case we just want to talk about it.
And I
So yeah,
just spent there.
yes.
You're saying?
I was saying, wait, you guys are live. Well, yes.
Yes. Hello, we are live.
Hello,
It's
Billiam.
it's surprising. It's surprising. I know we are so
Oh, that was very cute, Billiam. I can't even.
Okay.
It is okay.
Actually, I interpret in the sarcastic way because, like, it's been so long, and I'm like, oh, no. Actually, people get enthusiastic about people getting live from.
Yes, of course, people would get enthusiastic about other people being live. It's twitch.tv. It's like a streaming platform where people are live and talk to each other. Rimbi, have you been online?
No, but I'm listen. I don't know what feelings are. I don't,
You're also like systemic. I guess that makes sense. Anyway, I was just saying that I today I slept for 12 hours and I woke up. I looked at the time, realized that it had been almost 12 hours, and I was like, man, I really do need to get up. And so I did, and I spent the entire day sleepy.
but yeah, we just slept 12 hours. I mean, oh yeah.
Yeah,
Okay. Okay. So actually, I think we kind of missed one thing, which was and which are conservationships.
which is, sorry, I didn't get the last word.
Conservationships.
What does that even mean?
Okay, it is. This is a legal process that a person that is considered too disabled to, get financial
Yeah,
um,
yeah. If you get
stuff.
60% of
Hmm?
disability thing, right?
No, 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 no. I'm talking about the like you have a legal guardian, like
Oh,
that does that s- takes care of your financial stuff, can take
oh, there's no even privacy in that sense. Like when you are disabled to the point that you have to sleep in your parents' room, and I get like, person, how can you even exist? Because that would drive me insane.
what? I'm sorry.
When you get to the point that I'm not even talking about legally. I'm talking about like people that are disabled, like physically disabled, to the point that they need to sleep in the same room as their parents or as their guardians or like any other family member. And I'm just like, how can you even exist? Because like that's the point in which the entirety of your privacy is removed from you. You don't even have your own space.
Because yeah, um, I didn't thought of that situation, but now, but we had,
I have
but
disabled
in certain
friends.
families,
They are more disabled than me, I guess.
well, I don't have that much friends, so thank you for your input.
Damn it!
I know. Actually, I was not able to do that because actually, it's like if you take away me my privacy, I might be just dead, just be dead.
Honestly,
Because
same. Because my parents, I mean, my mom knows, but my dad doesn't even know I'm autistic. Let alone trans. Like, no one knows I'm trans. No one fucking knows.
for a safety, I mean, because I have my privacy violated several times actually, and one of the times could actually put in the risk of coming out accidentally as queer. So it was for a stupid reason even. So I guess in that sense, it's like when we are from marginalized groups, we're just we start to prioritize even more privacy than probably the others that don't belong in marginalized groups. Because if we don't have that, we might be in risk of someone taking action. Because what a fear actually I have was that when I was a teenager is like, so that I would write very messed up shit, and I said this on the last episode, I think. If someone read that, they could consider putting me in a psychiatric ward because they probably would think that I would genuinely mean that. Now that was me having very many moments of mental distress. I was not okay. I probably needed some therapy, but I was not going to get therapy in a fucking psychiatric hospice because you get fucking sedated all the time. You get stabilized. That's the purpose of psychiatric hospital. You get stabilization. They would think that I would try to commit something.
Hmm.
And there's actually attempts. So
And
I
that's why
mean,
you can't really separate privacy and autonomy. Because from the moment that you have no privacy, your autonomy is completely removed away from you because people have power over you.
no, they can read what I imagine reading what I write. It's like no, and then it would make judgment
Oh,
that are not accurate, but
Jesus.
that's because it's
Whew.
just my create. What?
I was just thinking about if people just read stuff that I've written like 3, 4, 5 years ago. Like,
Yeah,
shit
but
do
that
be
would
messed up.
happen.
Yep.
That was scary, and that's what happens if you have more controlling families that know that you're disabled. They might be afraid that you can do something that
Mm.
I don't know.
And
I
it's
just
more
don't
like
know when.
the least you can do something. For example, um, imagine I can't a lot of times clean my room. Like I can't vacuum. I can clean the dust, but vacuuming is a lot of times physically too demanding and the sound is already too overwhelming. It was already super hard for me even before I was physically disabled because of the noise, and now it's just way too overwhelming overall. I it's a thing that is really hard for me. And well, I'm not rich enough to just have one of those little robots that does it for me, like when I'm just in other part of the house. So, a lot of times it falls into my mom doing that. Most of the times, really. And just because of that, I more often than not feel like it is a step into people assuming that they have more freedom to mess around my stuff than what they actually do. Because one thing is like, I need help with this. I can't do this on my own. Therefore, I need someone else to do it for me. Versus, this gives you the right to just touch everything now because you are already in this space. You know, it's a very tricky position to be when you physically can't do something and then people just assume, oh, because person can't do this, therefore we have the right to do that. It's
Yeah.
very easy to fall into this assumption, apparently, but it always leaves the disabled people in a situation which is like, just because I need help doesn't mean that I can't make decisions on my own, that I don't have a word to say, and that I can't just, tell what other people can or cannot do about my things or what they can see or can't.
Um. it's also terrifying because I was probably would consider I was also considering like if I would get personal assistance, like because I generally sometimes struggle to clean to do the chores, and that's
Mm-hmm.
fine because I'm fucking disabled. But I would be always paranoid because like, what if they check all the stuff? What if they steal? What if they did check and see that what I have? What they make a it's tiring. I cannot be this paranoid, but unfortunately, it does happen.
I mean, put it this
It's a
way.
kind.
I can't even blame you for you being that paranoid, quote unquote, because I have people in my family who work in the cleaning housing thing, you
Oh
know?
no! Oh
And
no!
I don't think you understand just how much they talk about literally every person of the houses they clean. And I'm just like, how do you think it is okay to share that kind of information?
Oh
Who do
yeah,
you
my mom
think you
also.
are?
Oh,
Ah,
my mom was also a cleaner, and she would also do that. She used to clean closets. And another thing that um um because imagine if if they found, for example, sex toys like in the drawer.
I mean, I know a lot of people that would just straight up comment on that.
Of course they would. Um,
I mean,
and
they comment on simple stuff like, uh, oh, they left like a piece of clothing in the same place for an entire week. Like next time I went there, it was still in the exact same place.
yeah,
They
yes,
will
yeah,
comment on
exactly.
something like this.
Yeah.
I mean, they will comment on literally anything else. And like this is the
Yeah.
tamest thing. I'm saying this one to not enter on straight up racist slurs on stuff that I've heard from people that work on the field. So like it shit gets like absolutely insane. It gets insane. So like I don't think you're paranoid for going like I'm not so sure I can have someone else in my house doing the cleaning and feel comfortable with that because I feel like they might, just start talking about it. Yeah.
Yeah, because especially because I'm extremely eccentric. Like people, if it neurotypical, like I just act in a very neurodivergent way. And people find it odd. That's even sometimes even for neurodivergent. Anyway,
Yeah, if you
another thing,
get called
another
extravagant,
thing,
that's probably the best case scenario. Because people are fucking mean.
eccentric.
Eccentric, yes.
No. Being perceived as mean, not being perceived as eccentric, but of course I would get called words like crazy or just nuts or just
Or straight up retarded.
yeah.
People are mean
Honest,
like that. No, like people will jump to the worst. Like a lot of times, like I'm not saying that oh everyone is fucking evil and humanity sucks. That's not the kind of mentality that I'm using here. I'm just being like when people want to be mean, they will.
they will. They'll find you the most vulnerable spots and they would play with it. Yeah. Another thing that actually I noticed, uh, because when you deal with a lot of speech laws, you feel it's more visibly it's like um you can easily perceive that you're losing autonomy. Like it's more easy to be perceived. Uh, Geez, language is getting hard now. It's like because it's the thing that I know that I noticed. Because even as a kid, actually, I wanted to go to medical appointments by my own because I wanted to express my own concerns as
Yep.
by my own. Yes, and doesn't help that I deal with speech loss, right? And one of the things that actually I know is like I remember twice. This happened twice with two different people. Um, I was ordering something, and he would speak over me. Those people, both neurodivergent, like, and I had to speak even louder so the person could understand what I was ordering because the person was holding over me.
I mean, put it this way doctors will talk over you, so.
No, I'm sorry, but no, we're talking about two neurodivergent people
I know, I
that
know.
did this to me. And then I'm like, you're talking over me. and I had to say, I had to speak louder so the person could understand. Because like I totally got a little mad. I didn't call out at the time, which fair. They could say that I didn't call them out.
I
Fair.
mean, wow, I am so sorry that the victim didn't stand up for themselves. What the
I did
fuck?
because I kind of repressed.
I mean, yeah, of course you wouldn't. I mean, you were in a stressful situation already.
Yeah, and I was like, please, this kind of reminds me of my childhood situation when people would talk over me, and actually I don't like it. I mean, so like I just have always the need to actually always because you can always like even if I'm dealing with speech loss, I still talk and I still talk anyway. I still find my way to talk, even though it's muffled, not comprehensible, absolutely shit, poor piss type of speech. But I still do it because I don't want to lose the little autonomy that I have in my life.
It makes sense.
God damn it, Dave! Why you have to do that?
To do what? What did I do? Wait, was it me?
Yeah.
Damn it! I'm sorry.
No, it's okay. Actually, I didn't understand that time. just didn't. I
I
actually
actually
kind of
don't know what
repressed.
situation you're talking about. I'm sorry.
It wasn't. It was in. It was in. Like we were paying the meal, and you spoke over me when. Uh, when the clerk was asking what meal I had, so I could pay. That happened. I think.
I have no idea on
No, it's
when that
okay. Yeah,
was.
it's like I don't feel
I
resentment.
apologize.
No, I don't feel. No, that's okay. I don't feel resentment, but I just because I kind of repress it because like it's okay. It's like it's natural for them to do that. But it's just like, but then, but I just remember this tendency that I have, which is not just you both. It's like all the time. I just is expressing the way that I still keep talking even when I'm dealing with speech loss because I don't want to lose autonomy. I want to
Mm-hmm.
speak for myself. I want to speak because people don't take seriously if I type. So basically, I have to speak, if it means that I will be piss poor type of communication. But it is what it is. I was
Yeah.
just it was the trigger for that realization actually.
Billion just said, I think rights to a private life is an official part of human rights, by the way. And yeah, people have supposedly the right to privacy and to be autonomous, but guess what? Human rights are very pretty when they are written down and put as the epitome of the Western world. But when it comes to actually following them and giving people the rights that they should have, because supposedly everyone has the right to have education and healthcare and all of that. Those are supposedly human
But
rights.
there's
Housing is a
but
human
there's
right.
no yeah because there's no free healthcare here. There's no free even education. Like there's free, but
Oh,
like you have to still have to pay the
anyway,
books.
and yes, but like yes, but we are still talking about like, oh, there's no free healthcare. Sure, there isn't totally free, but you compare what we have here to like the American system, and like we are blessed because if you go for a fucking ambulance, you're not gonna pay for the fucking ambulance. If you are in a family that is considered poor by whatever standards, and you go to the to the health facility, like the one where your family doctor is, you won't pay to get an appointment. You know, medication is
Yes,
still mostly like it isn't free, and some of it is somewhat expensive, but it still has a lot of um state of the state pays a lot of the medication. For example, the medication that I'm taking right now, the price um of selling it to the public is almost €7, and I paid one something for it. So
huh, that's
exactly,
yeah.
exactly. So what I'm saying is like, yes, sure, it isn't free, but when you compare it to, and I'm not saying that, oh, because we are so much better than everyone else, then we should be grateful. I mean, uh, but on the
No, I
other
just paid
hand,
70 euros for the emergency visit. For I just paid 70 euros for the visit to the emergency room, so for nothing, literally,
yep,
almost nothing.
Maybe I said that I should be asleep in 10 minutes 20 minutes ago. I don't think
Sorry.
it was that long. But still, I think we should end. I don't know if there's anyone online that I would want to rate even. I'm not sure I'm going to go through the trouble of trying to rate someone. William, do you have any suggestion on rating people? Is there anyone you would like to go to? Is there any friend you would like to meet? Because otherwise I might just end.
And we just call it a night, apparently.
Yes, do you want to do the summary thing?
Oh, I have to? Okay.
I mean, you don't have to. I'm asking if you want to.
Sorry. I will do it. So, basically, as you said, is that privacy and autonomy are very close concepts. Well, um, and I guess because we are both disabled, we are more prone to lose that privacy because people ask a lot of intrusive questions that they don't have to because that's fucking ableism. Because, like, like you don't ask why you don't ask why they are neurotypical. You know,
I am sorry. Why do you have any problem? Because like that deal of you doing small talk with me is just so fucking weird, man. You're standing for so long. Don't your legs hurt? Is anything wrong with you? Like those questions would be fucking rude. Like
yeah.
how
And
can
we don't
you how
ask
can you be up for so many hours? Like how can you sleep only 6 hours per night? That is
hey, that's
so
me.
unsettling. Okay, but yes, but put it this way, I sleep like 10 to 12 sometimes, so.
Yeah. Okay. Yes, if we do this as exercise, it's pretty ridiculous. But people ask this because it's like they see us a kind of exotic thing. Like, oh, we just have a disability. You're not supposed to have a disability, but you have it. Anyway,
You are so inspirational.
I'm not. I'm literally a case for a psychiatric ward. I'm not inspiration whatsoever. I'm inspiration to commit
Oh, you don't
something
let
that they should not
yourself
do.
be brought down for your struggles. I admire you so much that you are doing so much even though you're disabled. If you only knew the amount of times I've heard this, non ironically, and I'm just there like I'm gonna slap you in the face.
But Dave, you are
oh,
so inspiring. You are recovering so much. You are waking up and getting out of bed, even though you're in tremendous amount of pain that is mostly caused by capitalism. Uh, and you're doing
exactly.
stuff, and you're doing
Oh
classes, and
my
you're teaching
god, how
kids.
how
Oh my
can
god,
you?
you.
I would never be able to. That is so inspirational and like, oh my god, it must be so hard for you. Well, shut the fuck up. I don't want
Yeah,
your
you.
condescending shit. I want working conditions and just to have a fucking living and not want to, have people ask me intrusive questions every single time I'm just existing in a room.
I am just an inspiration to commit suicide. That's
Jesus fucking Christ. I mean,
that was. I literally. This is very messed up. Bad. I should not say it, but pretty good statement.
I understand your statement. I understand where you're coming from, and therefore I will refrain from. Yeah, goodness, my brain just died.
Because get it, because mentally ill people should recover and not be self-destructive. We both. Um. So another thing that it has been said is, well, we talked about our workplace, we talk about healthcare, we talk about in personal lives how privacy is violated and the consequences of it, and also we talked about how the whole dilemma that we should disclose or not the diagnosis. Um, I think I should make a note. I know it's not a summary. I'm just even adding more stuff, and you need to sleep. I think with visible disabled people, they don't have. I'm talking about visibly physically disabled people. They don't have the choice to disclose or not the diagnosis. I should make that
Mm-hmm.
note because I kind of forgot to do that.
I mean, I kind of
Um,
did it in the beginning because I
sorry then.
started. I started by talking by saying that in a day in which my fiber was particularly bad and I was having a lot of struggle moving, walking, going up and down stairs, and I had to sit a lot, was when people just started asking a lot of intrusive questions that I really did not want to answer. So the more visibly disabled you are, the more prone you are to have people just being fucking dicks and wanting to know a bunch of stuff about your life that you are really not in any obligation to share.
Yeah, but I was talking more about the workplace, like because they don't have the choice to disclose the high diagnosis from the employer. So like they would be ultimately discriminated because they have a very visible disability. That's what I was talking about. Or better, what I was going to talk about. Okay, not sad because I cannot speak from those people. I'm not visibly physically disabled. Um, and I think last thing is, well, we dealt with a lot of personal shenanigans around this, so that's the better conclusion. That's
William has a better conclusion. I'm not here as an awareness exercise, and I stand this quote so badly.
yeah. We should end with this quote. Not this bad conclusion. Also,
We
I'm sorry
should
for my
say.
bad joke.
Geen it's okay. It's okay. So I think we're gonna end here. Next week we will hopefully be back if no one has orchestra concerts 2 weeks in a row and 2 other weeks in a row of having chronic pain, being a pain in the ass, literally and otherwise, and not being able to stream for like an entire month or something. I don't know who that person was. Certainly not me. It would not be me.
I'm so sorry, David. No, Dave. I didn't have any fault. They just decided to schedule the whole concerts. I mean, I know.
I'm actually going to have a concert next week though, but it's not on Wednesday, so we're fine. And I won't have rehearsals during those days. So hopefully next week we'll be back with a new theme, hot in the hot as hot sauce and hot topics and stuff like that. So I am just gonna end stream. I'm not gonna raid anyone. I am too tired. I need to sleep, and capitalism is a bitch. And thank you everyone here that were here just to keep us some company, just lurking, or just existing, because existing is also very nice.
Unhard, by the way. It's very hard.
Anyway, peeps, bye bye.
See ya.